He had it set for you to go when you walk in here at 2 o'clock.
Okay.
So it's recording right now, so.
Okay. Okay. Thank you.
Yeah. Okay, thanks.
I'm sorry. Thank you very much. Let's just start today's topic. Is about the lecture 2. So we know health information has changed the health care in the United States in the past decades. There are many factors have proved these viewpoints. For example, healthcare information systems have grown rapidly in the last decade. For example, in 2011, 55% of physicians had adopted an electronic health record system. About 3/4 of adapters reported that use their EHR system resulted in enhanced patient care. Besides, nearly 1/2 of physicians currently without an EHR system plan to purchase or use one already purchased with next year. So that means healthcare information system is growing very fast. Also, in the past, healthcare information system moved from isolated software system in hospitals or primary care organizations towards solutions which support a continuous medical process and include multiple healthcare professionals and institutions. Utilize ubiquitous computing healthcare environments and also include in-breath technological advances typical of the domain of today's pervasive software applications. So this is the second change in the health information system. In fact, the health information revolution is come from the patient and the doctor's relationships change. We know in the past, the model for the healthcare is paternalistic model. In this kind of paternalism model, there's a relationship between the physician and the patients. The physician play an authoritative role in determining how much information to disclose to the client and encourages his or her recommended treatment. But now, the healthcare is changed from this model to patient-centric health model. That patient is everything. So it's totally different from the old model. In the patient-centered care model, it presumes that activity involvement of patients and their families is not just decided by the physicians. So currently we have it's a two partnership. One is doctor side, one is patient side. Okay? When the doctor cannot make decision by himself, we need patients and the families in the decision making. about the individual option for treatment. This is very important, especially for some disease, such as diabetes. In this kind of disease, the patient's options, the patient's ideas are very important, because that's depend on how the patient will do. So, in the patient-centered care model, it has 4 key attributes. The first one is it's a whole person care. Okay? The second feature is the coordination and communication. It's not just the physician's role in determining the treatment, in makes the decision. It must communicate with the patient's family, even communicate with other doctors. So this is very important. Also, the patient-centered care. In this model, we need to provide patient support and empowerment. Patients have some power, not just the physicians. Also, we need to make everything ready access, include the patient's medical records, its history of the patients, and also other information. So everything is just based on the patients. So we call it patient-centered care. So this kind of change from the past model to the patient-centered model, the change that makes the health information system will be changed. In fact, this kind of change has been listed by some people. They just organize them. So you can, first the focus of the care is changed from the discrete visit to ongoing care relationship. In the past, just the patient go to visit the doctor, visit the hospital, then just the doctor decide what treatment to cure the current disease. However, now it's not different. It's different. We need the patient to be cared continuously, no matter he is healthy now or not. Okay, so it's ongoing care relationship. Also, in the past, the doctor is a major role, but now we need to consider the patient's needs and the values. For example, in diabetes, the person want to eat some special foods. If the patient does not agree with you, you have to give him another idea. Some patients like this food, some patients like that food. If the doctor say you just like this food, that's not enough. Okay, you need to based on the patient's needs and values to make a plan. So also for the control, in the past, the care is professional in control, the doctor control, the hospital control. Now we need to let the patient control, include the medical records, include the information, also the treatment. Okay, so there are a bunch of things. Also, there is talk about openness. In the past, the medical docs records generally is secrecy. Okay, I'm not sure you in some places you have these things. Every doctor, even especially for the cancer, sometimes. And remember, in China, some hospital they just hide the information. Don't want the patient to know. Okay. Even you cannot access the medical records. It's difficult. But now you need to make everything open. Transparency. Let the doctor know, the family know, and the patient easy to know. Okay. Also, there be different things. For example, for the collaboration in the past is demarcation. We need cooperation. So different things means the health is changing. So we need the health system, health information system to change, okay, to make it very, very, very changing. So, as we know, this change toward the partnership and the patient-centered care involves change in information system architecture more along the lines of social network than the traditional enterprise-centric systems. That centric system has been implemented in the past 30 years. Just this health information system is based on the hospital, based on hospital's needs, based on hospital's cost. We don't think about, we never consider the patients. But now we need to consider patients, also consider other things. So make it more like a social network. It's not just the enterprise-centric system. So this is the big challenge. So in order to advance this revolution, to make the change of the health information system, U.S. government has played a great role and contribute great effort in this revolution. In fact, in 2004, President George W. Bush, he signed an executive order. We call it EO 13335. This EO aims to provide leadership for the development and nationwide implementation of an interoperable health information technology infrastructure to improve the quality and efficiency of healthcare. That's the aim for the EO. So, in this EO, they plan to establish within the office of the Secretary the position of National Health Information Technology Coordinates. Okay? The work of the national coordinates is consistent with the vision of developing a nationwide interoperable health information technologies infrastructure. In fact, this infrastructure can benefit the health care. In order to benefit the health care, there are several goals they want to achieve. The first one is to ensure that appropriate information to guide medical decision is available at the time and place of care. The second one is to improve healthcare quality, reduce medical errors, and advances the delivery of appropriate evidence-based medical care. The third is reduce healthcare costs resulting from inefficiency, medical errors, inappropriate care, and incomplete information. Also, we have another 3 points. The fourth is promotes a more effective marketplace, great competition, and increased choice through the wide availability of accurate information on healthcare cost, quality, and outcomes. Okay. The fifth is to improve the coordination of care and information among hospitals, laboratories, physician offices, and other ambulatory care providers through an effective infrastructure of the secure and authorized exchange of healthcare information. The last point is to ensure that patients' individually identifiable health information is secure and protected. They have these 6 points. Okay. In fact, after President Bush signed the EO, then they established the Office of National Coordinator for Health Information Technology within U.S. Department of Health and Human Services. Currently, this guy is the coordinator. So that means the government do some things. So after the coordinator was appointed and the office of the national coordinator was established, they did some things. The first thing they did is on July 21st, 2004, it announced the Decade of Health Information Technology for deliver consumer-centric and information-rich healthcare. See here, this is consumer-centric. It's not physician-centric. So this is a total different from the old model. The vision is to build a national health information network. We also call it NHIN. This is important things we need to memorize. Okay? In fact, this NHIN is of religion health information exchanged formed by healthcare provider who will utilize electronic health record system. Okay? So we need in the future we need to know more about the NHIN. In fact, in the original term national was changed to nationwide in January 2006. So now it's called National Wide Health Information Network. It's not called National Health Information Network again. In fact, this National Health Information Network is not a physical network that runs on server at the U.S. Department of Health and Human Services. Nor is it a large network that stores patients' records. What it is? Why we call it National Health Information Network? In fact, the Nationwide Health Information Network is defined as the set of standards, services, and policies that enable secure health information exchange over the internet. So that's the definition for the NHIN. In fact, this network plans to provide a foundation for the exchange of health information across diverse entities within communities and across the country, hoping to the goal of High-Tech Act. I will explain later what's High-Tech Act. Okay? So, this critical part of the National Health IT agenda will enable health information to follow the consumer behavior available for clinic decision making and support appropriate use of healthcare information beyond direct patient care, so as to improve population health. In fact, this is why we talk about this one. For the direct patient care, generally, some people is sick, then he go to the hospital and get treatment. But for the population health, it's not just related to the direct patient's treatment. Also include some research in the health, okay? Service in the health, such as library, medicine library. They include a wide sense. Also include the well-being of the population. So this is not just the direct patient care. For this kind of information, you can find from the website in the HHS. So just now I talked about the HITECH Act. What this act means? In fact, this act is called Health Information Technology for Economic and Clinical Health Act. This act is part of the American Recovery and Reinvestment Act of 2009. That's the act in 2009. The U.S. launched the American Recovery and Reinvestment Act. So this HITECH Act establishes programs to improve healthcare quality, safety, and efficiency through the meaningful use of certified EHR technology and security health information exchange. So we also talk about EHR. Okay, this is important things the United States want to do. In fact, on HITECH, eligible healthcare professionals and hospitals can qualify for Medicare and Medicaid incentive payments when they adopt certified EHR technology and use it to achieve specified objectives. So that's a good news for the healthcare professionals and hospitals. So now let's talk more about National Health Information Network. In fact, there are 3 initiatives launched to help expand security information exchange efforts, use national-wide health information network standards. This is the first one is Nationwide Health Information Network Exchange. The second one is called the LACTA project. The third one is called Connect Software Solution. So let's talk about the Nationwide Health Information Network Exchange. What it is? In fact, this is the group of federal agencies and private organizations have come together to securely exchange electronic health information. These organizations are helping to develop nationwide health information network standards, services, and policies, and are also currently demonstrating live health information exchange. So that's what this kind of organization doing now. Why it is important? These entities are able to send and retrieve electronic health information to support the latter patient care, streamline benefit claims, and improve public health tracking. That's the reason why it's more important. It's very important. Okay, this is the first project. The second one project they called the LUACT project. The LUACT project, in fact, they launched in March 2010. It's developing standards and services required to enable secure directed health information exchange at a more local and less complex level. That's different from the previous one. Okay. This one is a more we talk about it, it's more focused on the local level. Okay. In fact, the information exchange at the local level and among the trusted providers in support of the stage 1 meaningful use incentive requirements. That is a primary care provider send refer to a care summary to a local specialist electronically, or a physician requires lab test electronically. So this is not the national scale. It's just local scale, local level. So it's more focused on the local. Why it is still important? In fact, this project will expand the existing nationwide health information network standards and services with a policy framework to enable the simple, direct, and secure transport of health information between the healthcare provider at local level and the patients. So definitely this is important. So the third project is called Connect. Connect, what's Connect? Connect is a free open source software solution that supports healthcare information exchange both locally and at the national level. So this is the open source software solution. Okay? Collect use nationwide health information network standards, services, and policy to make sure that health information exchange are compatible with other exchange being set up through the country. In fact, the Connect is the result of a unique collaboration among federal agencies that is coordinated through the Federal Health Architecture Program and ONC. Okay. So this is the third one. Also, why it is important. In fact, now the Connect is available for free to all organizations. That means the Connect can be used to help set up health information exchange and share data using nationally recognized interoperability standards. We also talk about the interoperability standards because our course is about this one. Okay. In fact, this software solution was initially developed by federal agencies to support their health-related missions. That's the only software solutions the federal government just involved. Okay. So another thing we need to know about the government's contribution and efforts is the Federal Health IT Strategic Plan from 2008 to 2012. Okay? In fact, this strategy plan is very important is map the future of the health information system in the United States. In fact, this plan has two goals. One is patient-focused health care. The other side is population health. Each has 4 objectives. The first goal is about the patient-focused health care. It's aimed to enable the transformation to high quality, more cost-efficient, patient-focused health care through electronic health information access and use by care providers and by patients and their designers. See here, not just used by the care provider, also used by the patients. So why we call it patient-focused health care. The second is called population health. Just that we talk about the patient health care. What we care about is not just the patient health care, but also the population health. The goal for the population health side is to enable the appropriate, authorized, and timely access and use of electronic health information to benefit public health by medical research, quality improvement, and emergency preparedness. So this is the second goal. For each goal, we have 4 objectives. Okay, the 4 objectives for the first goal. The first objective is about the privacy and security, because privacy and security are very important. Think about this one. When you have medical records, you cannot just let everybody know about your records, okay? Because there are privacy in it. Also, the security issue. Security, some people can change your medical records or retrieve your medical record. That's also good. So the first things for this strategy plan, for the goal, the objective is to make the electronic exchange access and use of electronic health information systems. You can use it, you can access, but at the same time, we need to protect the privacy and the security of the patient's health information. Okay, so this is the first objective. The second objective is interoperability. Interoperability is very important. Why? Because think about this one, you develop many systems. Different systems cannot communicate. That's not good. Okay? So you move the information of electronic health information to where? And when it is needed to support individual health and care needs, that's the interoperability issue. We need to solve this issue and make the system to be interoperable. Okay? This third objective is the adoption. Why we say the adoption is his objective? If the people, the doctors, the physicians, the patients, they don't like to use this kind of things, that's also not good. So the third objective just promote the nationwide deployment of electronic health records and person health records that put the information to use in support health and care. This is the second one. The physician used the electronic health record. The person used the electronic health records. Also, patient can use the patient health records. This can make it adopted. Also, is the objective. The fourth one is the collaborative governance. Governance is to establish mechanism of multi-stakeholder priority setting and decision making to guide the development of national health IT infrastructure. This is important because not just one entity, the bunch of entities. We need to how to make them cooperation. That's important. Okay? So this is the objective for the first goal. The objective for the second goal is similar to the first goal. Also, we have a privacy and security issue. But this is for the population health. It plans to advance privacy and security policy, principles, procedures, and protections for information access and use in population health. For the first one, just for the patient's care, but this is for the population health. Also, we have the interoperability issue. Enable the mobility of health information to support population-oriented use. Also, we have adoption. Promote nationwide adoption of technology and technical function that will improve the population and individual health. Second one, the last one is almost similar for the first one. Okay, just one is used for the patient care. One used for the population health. Okay, so that's all. We just finished. Okay, so so we just the next time we should know what's happening here. I'm not sure if they record or not. I will ask them. Okay, let's stop the system. System. Shut down. 您买了这本书吗？啊？不要翻，网上有那个电子版的。它这个是违法的，你在美国念用的违法的，我是。其实这个课可以你把这个 slide 你要在自己电脑上然后把
Monday. Not too bad for a Monday. How about yours?
It's alright. Yeah.
It's still a Monday though.
It's a Monday. Got most of my classes on Monday and Wednesday.
Oh yeah?
And Tuesday and Thursday it's practically nothing. We got one class Tuesday and Thursday. And Friday.
I think that's good.
Yeah.
What in the weekend?
Yep.
I doubt anyone really is done yet in this
We
class.
just have to have the free articles that one's to write.
Right.
Once for them.
Yep.
Fucking scared me.
Yeah. I was just talking about that email she sent. Talked to her on like Friday about it. I was like, yeah, I don't have a party. Am I supposed to? And she's like, well, just send me an email. I was like, okay. I never did that.
Oh, my class, he's got dropped. He's had a problem with financial aid, so he couldn't get on campus or anything.
Oh God, really?
Yeah.
Can you get back into them now?
Yeah, like my loan went through today, and I went to go back, have them re-added, but apparently I need to talk to every single professor and have them re-added. It's such a pain in the ass.
So is this your last semester or your last year?
Last year, I worked over the summer, else I couldn't last semester. You on the same plan then, or
It should be my last semester.
December graduation date?
It would have took me the rest of the year, but I did take a couple of summer classes. It actually worked out real nice this summer. I had an internship that I did, but it started after the classes got over. So it filled up perfect.
Pretty lucky.
Yeah.
Sweet. I started my internship before the last semester was even finished with. Right up until, a week before last week. So. Oh well. Extra semester around.
It's important.